Greetings to the viewers of this video. In this video, we are going to see what can we do to reduce the oxidation of a parenteral preparation. Let us see the introduction. Parenteral preparations are medications that are administered by injection. They are often used when a patient cannot take medication by mouth or when the medication needs to be absorbed into the bloodstream quickly. However, parenteral preparations are susceptible to oxidation, which can degrade the medication and make it less effective. Now, moving to the next slide. There are a number of things that can be done to reduce oxidation of parenteral preparations. Let us see it one by one. First is to use antioxidants. Maintain the solution under nitrogen atmosphere throughout the manufacturing process. Purge the container with an inert gas. Adjust the pH. Use metal chelators. Use light-resistant packaging. Store the preparation at the correct temperature. Let us see these topics in detail. Moving on to the first topic. Use antioxidants. Antioxidants are substances that can prevent or delay oxidation by scavenging free radicals and preventing the formation of reactive oxygen species, ROS. Common antioxidants used in parenteral preparations include sodium bisulfite, ascorbic acid, and ethylene diamine tetraacetic acid, EDTA. Now, going on to the next slide. Maintain the solution under nitrogen atmosphere throughout the manufacturing process. Let us see specific examples of how to maintain a solution under a nitrogen atmosphere throughout the manufacturing process. Moving to the next slide, and here are the 3 examples. When transferring a solution from one container to another, use a closed system transfer system. This typically involves using a pump and tubing to transfer the solution directly from one container to another without exposing it to air. To sparge a solution with nitrogen, bubble nitrogen gas through the solution. This will remove oxygen from the solution and replace it with nitrogen. Sparging can be done in a variety of ways, such as using a fritted glass sparger or a dip tube. To use a nitrogen blanket, create a layer of nitrogen gas over the surface of the solution. This can be done by bubbling nitrogen gas through the solution or by using a nitrogen blanket generator. Let's navigate to the next slide. It is important to note that maintaining a solution under a nitrogen atmosphere is not always possible or necessary. For example, if a solution is only going to be exposed to air for a short period of time, it may not be necessary to maintain it under a nitrogen atmosphere. However, for solutions that are sensitive to oxidation, it is important to take steps to maintain them under a nitrogen atmosphere throughout the manufacturing process. Let's advance to the following slide. Purge the container with an inert gas. Oxygen is a major contributor to oxidation, so purging the container with an inert gas, such as nitrogen, can help to reduce the amount of oxygen present and slow down the oxidation process. Let's move ahead to the next slide. Adjust the pH. The pH of a solution can affect the rate of oxidation. In general, oxidation is more likely to occur at acidic pH values. For this reason, parenteral preparations are typically buffered to a slightly alkaline pH. Let's proceed to the next slide in the sequence. Use metal chelators. Metal ions can catalyze oxidation reactions. Metal chelators are substances that can bind to metal ions and prevent them from acting as catalysts. EDTA is a common metal chelator used in parenteral preparations. Let's continue to the next slide in the deck. Use light-resistant packaging. Light can also accelerate oxidation, so it is important to use light-resistant packaging for parenteral preparations. This may include amber glass vials or foil over wraps. Let's move ahead to the next slide. Store the preparation at the correct temperature. Most parenteral preparations should be stored at a cool temperature, such as 2 to 8 degrees Celsius. This helps to slow down the oxidation process. Moving on to the next slide. In addition to these general measures, there may be specific steps that can be taken to reduce oxidation of a particular parenteral preparation. For example, some drugs may be more stable in a specific pH range, or they may require the addition of a chelating agent to bind to metal ions that can catalyze oxidation. It is important to note that some of these measures may have other effects on the parenteral preparation, such as changing the pH or adding preservatives. It is important to consult with a pharmacist or other healthcare professional to determine the best way to reduce oxidation while maintaining the safety and efficacy of the preparation. Now, let us see the additional tips. Here are some additional tips for reducing oxidation of parenteral preparations. Use freshly prepared solutions whenever possible. The longer a parenteral preparation is stored, the more likely it is to oxidize. Avoid mixing different parenteral preparations together. This can sometimes lead to chemical reactions that can accelerate oxidation. When administering a parenteral preparation, avoid exposing it to light and air for longer than necessary. Thanks for watching.